Apologies to Radio New Zealand, I'm not Chris Hipkins. The alert came up, so you've got I've come off the bench. Kia ora anō. What I can report in terms of COVID cases today, there are no new cases in the community to report. There are 2 new cases to report in recent returnees in our managed isolation facilities, and we'll have all the detail in our media release today. So today I'll provide a bit of an update on the vaccine rollout, but I would like to start with just an update on what's happening in Victoria and also the international situation more broadly. So we're still seeing in Victoria a small number of cases, and you know that there's also been interest around New South Wales and Queensland. The latter 2 states have seen no community cases since the 2 who were identified in Queensland following travel up through New South Wales over a period of days out of Melbourne. There were 5 cases reported in Victoria overnight, 2 that were identified late last night and another 3 this morning. All of these are linked to the existing outbreaks. So what we're seeing there is an ongoing sort of trickle of cases coming through, but they are able to be linked to the existing known sort of clusters there. There is some further testing of residents in an apartment block, I think is on the South Bank, and they'll have the results of those over coming days. There will be an update later this afternoon on the current travel pause of quarantine-free travel pause with Victoria. On the international situation, we're seeing WHO reporting that new global COVID-19 cases have actually fallen steadily over the last 7 weeks. The average daily case numbers now globally are around half what they were at the peak in April this year, which was around 820,000 cases a day in April. It's the longest period of a fallen number since the pandemic began. So saying WHO does caution that the drop in cases does mark quite considerable differences in different regions, and in particular Africa, which would probably have be less likely to report cases because of lower testing and also has limited access to vaccines and treatment. We are seeing in the UK, in spite of their very good vaccination rates there, that they've seen an upswing in case numbers, up to about just over 7,000 a day at the moment. And just to put that in context, that would equate to around 600 cases a day here in New Zealand. So it's a pretty significant number. It was half that a week or 2 back, and you will have seen that translate into an extension of their current sort of restrictions on movement for an additional 4 weeks. This is also reflected in hospitalisations in the UK, with the difference being this time as those hospitalisations increase, over 70% of these are in people under age 65, in contrast to where they were in January earlier this year and earlier in the outbreak there. So these are things we keep a close eye on, and of course we do know in the UK that most of their cases are now are the Delta variant, which was first identified in India. On the vaccination numbers, first I'm happy to report the data that will be going up on our website represent a further consolidation and progress with our program, and with July's supply already secured and our program locked in for the next few weeks, the numbers continue to track upwards. As of midnight last night, we had delivered 891,702 doses. That's an increase on more than 116,000 doses last week, remembering that was in a week where we had a public holiday and also, as you'll recall, the nurses' industrial action on the Wednesday. More than 324,000 people have now had their second dose and are fully vaccinated, which is around 6% of the total population. So, slight contrast to the approach they're taking in Australia, we have maintained that 3-week gap between first and second doses here. So our second dose and rates, in other words, full vaccination rates, are high compared with around just over 11% of people, an additional 11% who have had 1 dose. So a total of around just over 17% of the total population. That's not the eligible population. Total population have either had 1 or both doses here. Yesterday, more than 21,700 doses administered nationally, and we remain about 7.5% ahead of plan. The Auckland region DHBs this week confirmed all Aucklanders over age 65 would have received their invitations within the next week. We know that many thousands aged 65 and over in South Auckland have already received their vaccine as part of a priority group in the scheduling framework. I think it's a fantastic effort. You might see in the data that are released that Auckland is somewhat behind their plan. However, remembering it's about a third of the population, they've delivered more than a third of vaccines to date. And I do know at the moment they've got a big focus on ensuring that all residents in aged residential care, which they have a substantial number across the region, are being vaccinated before at least having their first vaccine before the end of this month. There's a lot happening around the Auckland region. 8 community centres in the metro region now live, 4 new centres in addition to open before the end of June. There are 21 general practices have joined the program. An average of 10 new practices will start vaccinating each week from here. A reminder to everybody, now's a good time to update your contact details with your GP or healthcare provider. Make sure they are up to date, especially if you've moved recently. Tomorrow there will be a media stand-up with the Prime Minister where she will have more to say around the messages for people in Group 4 and the way bookings and vaccinations will roll out with that group from July. The vital part of our scale-up is ensuring we have enough vaccinators. I'm pleased to say as of midnight last night, 7,666, I don't think that's an unlucky number, vaccinators have completed the online training, and of those just over 3,000 have been active in the program. And additional vaccinators continue to come on board as we ramp up the program. And finally, I'm very pleased to report the latest encouraging research findings around population willingness to be vaccinated. Shows an increasing level of willingness. Our latest research report I've just received shows 80% of those aged 16 years and over say they are likely to get a vaccine or have already been vaccinated. That's up from 69% in March and 77% in April. Very encouraging, and within that broad figure we've seen the Māori potential uptake increase to 75%, further increase from 71% in April, and for the Pacifica population it remains steady at around 78%, noting that there was 59% a couple of months ago. We know that our Māori and Pacifica communities are considered high risk. We've seen in our outbreak last August that those are communities that were more heavily impacted, so it's fantastic to see this high and increasing level of willingness. There remains a core group of around 12% of people who at the moment say they're unlikely to be vaccinated, and about 8% of people say they remain unsure. So our challenge, and one we're more than happy to take up, is to continue to work with those groups to ensure we answer their questions and make sure they have all the information they need to decide what's right for them, and I hope take up that opportunity to be vaccinated. So I'll take any questions now.
What's your strategy around that? How will you make them take up the vaccine if they don't want to?
We have no intention to make people take up the vaccine. The government's been really clear from the start. It's not mandatory. What I think we will continue to see is that growing acceptance of and willingness to be vaccinated, particularly as the numbers get higher. Again, it will become, I think, a social norm, and I think we will see the number of people who genuinely don't want to have it will continue to decline.
Have you got a target number? You said it's 12% now. Do you want to get that down to 2, 3, 0%?
0% ideally, and the aim is to vaccinate as many eligible New Zealanders as possible, and of course our intention is to do that before the end of the year.
Have you provided any advice to the government around vaccinated people and MAQ? Given there's this new CDC study out in March that we've seen which showed 90% less of any infection for COVID in a real-world situation for the Pfizer vaccine, suggesting that almost everyone who's fully vaccinated with Pfizer does not get infected with COVID, let alone get sick. Given that, have you provided advice to the government on what should be done with vaccinated people with MAQ and whether they need to do a full MAQ study?
We're actually working on advice on this with colleagues across government, and this really plays into the whole reopening of the border. And there are 2 elements to that. One is, of course, quarantine-free travel, and we've clearly got that happening with Australia and the Cooks at the moment, and we will, we have ongoing work to see if there are other countries that could be brought into that quarantine-free travel arrangement. Then it's what might be some of the prerequisites for allowing people to come across the border outside of a quarantine-free travel arrangement without having to go through managed isolation. One of the things will be vaccination status, sure. However, even within that, there are questions around which vaccine, when they were vaccinated, and that will be also considered alongside the role of pre-departure testing and potentially testing on arrival is another part of that, and also where they have come from and how they've got here. So what's the a priori risk that they might be infected, vaccinated or not? Because even with 95% vaccine effectiveness, there's still a chance that people fully vaccinated could be infected.
With the prioritisation framework for Group 4, I guess, obviously the Groups 1 to 3 are focused on people who are likely to get COVID or are likely to have a really bad reaction if they get COVID. Outside of that, there is still obviously age-related comorbidities. Young people are generally likely, more likely to get it. Has the issue of health looked into, though, whether young people are also more mobile and thus provide more of a risk for spreading COVID around the country and should maybe get vaccinated earlier?
Yeah, we're seeing some places like the UK are looking at going into that group because that's a group where they've got higher rates of infection at the moment. We are not looking at raising the priority of that group at the moment in New Zealand because we don't have community transmission of the virus. So our intention is still to stay with the in Group 3, over 65s and anybody under 65 with a pre-existing condition. And then the announcement tomorrow will be about how that rollout will be sort of staged through the under 65 population.
Have you recommended age-based cohorts for that for Group 4?
Find out tomorrow.
Have any DHBs begun scaling back or closed their vaccination centres because of the lull in supply?
No, they haven't, and the reason for that is that we have worked closely with them to ensure that all DHBs are able to deliver 100% of their plans for these next 4 to 5 weeks.
Some of them are ahead of 100%, aren't they?
Some of them are, so we're managing it carefully from the centre. Those that were ahead and had centres open and people booked, we want to continue supplying the vaccine so they can honour those bookings. So we're juggling it across the country, remembering that in each of these next few weeks, as we saw from last week, we will actually be vaccinating probably over 110,000 people every week. So that will continue at a high rate, which is more than we've had in the past.
So you wouldn't expect any of those vaccination centres to shut down or temporarily shut down?
Perhaps slow down. I mean, it will vary by region depending on whether they've got forward bookings or not. They may pause some centres, but the idea, of course, is to ensure that we are balancing the use of the vaccine across the country.
Are there any particular areas that are on your radar?
Not particularly. I mean, the team are doing it on almost a daily basis because we're pushing the vaccine out. The DHBs know how much vaccine they expect to receive. And the other shift that's happened, of course, is that because the vaccine can be stored at that 2 to 8 degrees for longer, there's not that necessity to call people in at the last minute to make sure we use vaccine up, so they can really use it to deliver to the priority groups and also to honour the bookings that are there already.
What does the data reveal about how the nurses' strike impacted the rollout? And are you confident that nurses acted appropriately on that day to continue the rollout?
Well, on the second question, the industrial action didn't, took place by nurses who were working in vaccination centres around the country, so they weren't excluded. The NZNO had agreed that their nurses in managed action wouldn't take industrial action. We did see a drop in vaccine delivery on the Wednesday last week, but there was still quite a lot of vaccine given, and it impacted more on the northern region and the Auckland Metro region than perhaps other areas, depending on the mix of staff that they had vaccinating on the day.
Do you have any concerns around the way that happened?
No, I don't have any concerns. I think that we had good dialogue with the NZNO. All the DHBs had in place the life-preserving services that were needed within the hospitals especially, and the NZNO gave us plenty of notice that their members who were working in vaccination centres would be taking action. I'll go down the back and I'll come over here.
Just in terms of that 12%, I know you're aiming for 0% in terms of vaccine hesitancy. longer term, does that 12% present a long-term, is it a manageable risk long-term, or does that kind of show the possibility of a pool of people that where there could be, risk and virus coming from in the future?
So, as we move further through the vaccination program, there's no doubt, and we can see this happening overseas, and in fact it's most obvious in the US, where states with higher rates of vaccination are able to relax some of the restrictions that have been in place without getting a big increase in infections. So two things here. There's no doubt that people who remain unvaccinated will remain at risk of being infected with COVID. The second thing is that depending on the size of the group that is unvaccinated, that will have a direct impact on the sort of other residual public health measures we will need to have in place. So the higher the vaccination rates in the population, the less sort of intrusive those residual measures will need to be. But once we get to say 70%, there will be a set of measures we'll still need to have in place, and the higher it gets, the less intrusive or restrictive those measures will be.
You've spoken about a kind of level 1.5,
Yes.
Longer term.
Yes.
Would that be based on this kind of cohort of people, that 12%, or would it be based on sort of a smaller or larger group?
Yeah, I mean, interestingly, we've seen some of the modelling of what vaccination rates of 70 or 80 or 90% might mean in terms of the number of cases and hospitalisations and deaths if you had no other measures in place. And again, what it emphasises is that the higher your rates, once you get up to 90 or 95% vaccination rates, then if you do nothing else, then the number of cases, hospitalisations and deaths gets much smaller. So then it's a matter of thinking, well, what else might we be able to put in place around ongoing, use of the app, the residual rapid contact tracing and isolation when we did have cases that would supplement the vaccination. Now, I should say that modelling is done by Sean Hendy and his group. You can ask for it. I can't give it to you, but they will be publishing it in due course. But we've just got a bit of a preview of that.
Just further to Justin's question. So if then in that 12% group, is it likely that sort of when we do sort of slowly open up, that those people, if you're unvaccinated and you want to go overseas, you'll have to come through MIQ if you're unvaccinated? Is that potentially what the trade-off is?
Well, it's hard to predict the future, but I would say probably more importantly, I imagine it will be hard for people to travel abroad unless they are vaccinated. Certainly, I think we're thinking seriously about what our requirements will be for people, at least in the sort of medium term, to travel to New Zealand, and the expectations around pre-departure testing, vaccination, and to be able to prove vaccination, and then other measures once people arrive here. And I suspect, in fact, I'm confident many other countries will have similar requirements.
And changing gear, do you have updated figures on the Group 1, Group 2, Group 3 vaccination rollout?
I do. I have numbers. If you like the numbers there, I can just pull those up here. I thought someone might ask for those. So, with Group 1, which is effectively our border workers and household contacts, we've got, so I'll sort of round them up or down a little bit. About 54,000 have had their first dose, and nearly 48,000 are fully vaccinated. In Group 2, 333,000 first dose, and around 238,000 fully vaccinated. And Group 3, it's about 145,000 have had their first dose, and 34,000 fully vaccinated. And Group 4, it's around 35,000 have had their first dose, and about 4,500 who are fully vaccinated. So those are sort of mutually exclusive. Those fully vaccinated are not counted in those who've had the first dose. So in total, it all adds up to the...
So why are there still about 6,000 people in Group 1 who haven't been fully vaccinated yet?
Well, they are likely to be people who have started work more recently in a border role and have had their first dose, and they're just in the process of getting their second dose. So
are we basing that on assumptions though, or have you asked sort of why that is? There are 6,000 people yet to be fully vaccinated.
Yeah, well, if I look at those who are the actual border workers, there's a difference of around 3,000, and those will be people who have had their first dose and either are either late for or haven't yet. It hasn't come around to have their second dose. Remembering that the border workforce is quite big and covers a whole range of roles, and so that would be my understanding is anyway that they would be scheduled to have their second dose, but it hasn't come around yet.
And are you happy with how the vaccine rollout has gone to each of those groups so far?
I'm very pleased with the work that has been done to get the vaccine to people, and of course our aim is in all of these groups we want as many people as possible to be vaccinated. And anyone working in managed isolation has to now be fully vaccinated. Even then there will be some people who have had their first dose because they've started very recently and will be scheduled to have their second dose.
Just on some cabinet.
Well,
Yeah, I don't-
thanks. Do you have a demographic breakdown of that 12%, and are there any groups that are overrepresented?
Yes, there is a demographic breakdown, and I'm sorry I haven't got that with me, but it's the latest Horizon research report, and we'll make that available as soon as possible, and you'll be able to see there are some differences by ethnicity and also by age, and my recollection is the sort of 25 to 40 age group are sort of overrepresented in those who are currently saying they're not going to have the vaccine.
And what are you doing to target that group?
Yeah, well, of course, we've got our broader population comms, but also remembering that that group is one that isn't yet eligible for the vaccine. So as we move into that group, then there will be some very targeted comms using champions and other people to try and reach into that group. I should say, and I just want to go back to, if we look at childhood immunisation rates, very consistently on average across the country, about 5% of parents sort of ultimately refuse to have their child vaccinated, and I'm fully expecting that we will land in at a very similar figure overall for our vaccination with COVID-19. We're going to make sure that everyone who is eligible is able to get the vaccine.
On mental health, how much of the $1.9 billion has been spent, and can you give us an idea of what it has been spent on?
I don't have those figures with me, but I can say that this has been the subject of a lot of questions of the Minister recently, and I think he's given a very up-to-date picture of the amount that's been spent and on what. So, I mean, we can provide that information subsequently, but it has been fairly well canvassed recently.
And Mike King's called the ministry, called your ministry incompetent and out of touch when it comes to mental health. What's your response to that?
Well, I just have a different view from Mike King on that one.
Just on a cabinet paper, or some cabinet papers that were recently released, you said that in Auckland or around the country, actually, after level 1, the country shouldn't automatically go to a period where people aren't required to wear masks on public transport. Why did you have that view?
Well, actually, I was quite surprised at the reporting of that, because if you read further into just a couple of paragraphs down in the cabinet paper, in fact, the way it was framed was, under level 1, by definition, there is no community transmission. So from a public health perspective, you could say there was not necessarily a reason, because it would be very low risk. There's not necessarily a reason for people to continue wearing masks on public transport or flights. But if you read further through the paper, actually, the advice, which was my advice, was, but there may be other good reasons for maintaining that, including it creates an ongoing prompt for everybody about the fact we remain in the middle of a pandemic, and it encourages a behaviour that reduces is one we maybe need to call on at any time if we have to go up alert levels. And in fact, it was based on that advice that the government decided to continue or to require the use of masks on public transport and on domestic flights, even under alert level 1, right around the country.
So how much longer do you think this policy should be in place then?
Well, I think but we've not been asked to and don't intend to provide advice to change that at this point.
And so just back to that, so are you completely satisfied with the mental health system as it stands?
Oh, look, as we saw from Heiara Oranga, the inquiry that was done 2 years ago, and the government response to that, there are big gaps in mental health and addiction services across the country that the inquiry identified, and with its 40 or so recommendations. And there's a team of people in this organisation and others right across the sector who have been working really hard to not only develop up an investment package, but then to implement that. And in particular, a cornerstone of that investment are these what are called access and choice primary mental health services, and it's great to see the continued increase in the availability of those right across the system, both in general practice but also in Māori and Pacific and youth providers, and that will continue to increase. And I'm very pleased to see that happening, because I think that is filling what was identified as a very big gap in the system. At the same time, there are still real challenges around specialist service provision, both mental health and addiction, and so there is ongoing investment and enhancement of those services. And what I'm comfortable with is that there's a really good understanding of what the issues are, and there is an investment underway to address the gaps that are in the system.
If it's $1.9 billion, and this is quite literally a case of life and death, are you confident you're actually getting this money out the door to the people who need it quickly enough?
Yeah, I am confident. I think if you look at the responses the Minister's given recently, you will see that there is a lot of money going out the door, and there's been a lot of work over the last 3 to 6 months to put in place new contracts with new providers that are coming on board from July, and so we'll see another big increase rolling out from July in the new financial year. Now you've got a specific question, so please.
Are you confident that for the just fiscal year which is finished, that you'll be meeting that 80% target in terms of wait times of less than 8 weeks, particularly around young people? It's a PT8 target, and the ministry have not hit it in recent years.
The wider sector. Yeah, look, what I can say, and I can reflect on my time as a Chief Executive at Hutt Valley District Health Board, it's a real challenge, the delivery of services to child, youth and family, mental health services, and there's a lot of demand, and there's been a lot of work gone into expand and enhance and streamline and make those services more available. And so it's an ongoing challenge, and I imagine we will continue to see DHBs not necessarily meeting that target, but we will keep reporting on it, because that's the whole point. That's our aim, is to ensure that those services people can reach those services within the 3-week
On reporting,
target.
you had to apologise to the Minister recently over what your officials had told him around what was available publicly. Is the Minister, how did that happen? Is the Minister really being transparent enough public enough data?
Yeah, and in fact, well before that apology, I had put out a statement saying that in terms of, and the issue where this came to a head was the publication of the Director of Mental Health's report. And I had put out a statement saying, look, there were a couple of things there. First of all, we could and should have talked more widely with the sector and signalled that we were going to change the information that was in there. And secondly, that there was no intention, and I apologise to the Minister that we had given him incorrect information. There was no intention to provide incorrect information. But once it was identified that some of the data that had previously been in the report were not available, we brought that to his attention, and we are making all that information available. And one of the things I asked the team to do a couple of months ago was to develop up a single place where all the information is able to be accessed, so like a single portal. That was done very quickly, and as soon as information and data are available, we are putting it up on there. So I can guarantee that certainly on my watch there will be transparency about making sure the data are available.
The new vaccinators,
Please.
The new vaccinators coming on board, firstly, are you confident that we'll have enough?
Mm-hmm.
And secondly, have you had to change the regulations in order to allow them to work?
Yeah, so on your first question, we've worked out at the height of the sort of delivery of the program, we'll need about 2,500 vaccinators at any point in time. So we aim to do a 3 or 4 to 1 to make sure that we had enough capacity, and we're well on track to do that. So I am confident we will have enough vaccinators. The other issue is about the ability of non-regulated workforce to be trained as vaccinators and under supervision to vaccinate, and the regulations have been changed and the training's been developed and people are being trained at the moment, so that will increase the pool of workforce available as well.
What's the percentage in terms of the unregulated regulators?
The unregulated was starting from 0, so it will be so the vast majority at the moment are regulated workforces, but it's a wide range of medical, nursing, allied health professionals, a huge range of both currently practicing and recently sort of out of the workforce practitioners who have done the training and are available. So I'm confident we will have enough down the back, and then I'll come.
I was just going to ask, with constrained vaccine supply, should vaccines nationwide be prioritized for people in the kind of lower groups before group 4? And the reason I ask is one of my colleagues has been looking into this story where a 30 A 30-year-old guy in Wellington called up the DHB and said, can I get the vaccine? They said, sure, pop by this afternoon.
Mhm.
While a 65-year-old in Auckland has been waiting for the vaccine, and the DHB there just says, keep waiting,
Yep.
we'll call you. Does that make sense?
So the sequencing framework is there for a reason, and that is to, on the whole, and for most people, it will largely prioritise as we move through commensurate with the vaccine supply. So there will always be stories, particularly differences across DHBs, and some of the people who are perhaps out of sequence being vaccinated has been a result of there being spare vaccine available that was going to expire, and our approach was to make sure we were using the vaccine up. That's less of an issue now. The important point here is that there's not a close-off date for any group. It's open-ended. As new groups come on, Group 1, Group 2, Group 3 still are able to be vaccinated at any point in time, but there has been and there will continue to be some overlap. The important thing is that we, of course, are using the vaccine up as we get it. It's only of value in people's arms.
How are you working out?
One thing though that a lot of these stories have in common though is that if you go to the DHB websites, they nearly all say, wait for us, don't call, we'll call you. But then when people seem to show any initiative and pick up the phone and actually call, the DHBs immediately turn around and pretty much give them the jab that day or the next day. Is this kind of an issue that people showing initiative are, I guess in a way, queue jumping?
Yeah. Look, I think it will be variable. Again, there will be stories and individual cases where this will happen, and it usually depends on the timing, if there is vaccine available. And again, I think we've done well. We have less than 2% wastage of the vaccine, which is very, very good by international standards. I think this will be less of an issue as we move into the further rollout. Again, more details tomorrow, and in particular around the role of the national booking system and how that will be used to help ensure that we are progressively moving through the population. I'll go here and then I'll come back.
Australia's reporting, just because you both here in the Prime Minister like to make comparisons with Australia, and it's a very similar situation. Australia is providing more data on specifically aged care rollout,
Yep.
and New Zealand is not. I'm guessing there is some sort of tracking behind the scenes around those numbers. Are you able to share how New Zealand's doing, or is there information, data that can be released around it?
I will check with you on whether we've got data that can be released. I can give some general comments. First of all, we know there are several DHBs that have already fully vaccinated their entire aged care resident population, this being one, Capital and Coast DHB, and there are others. The aim is, and this is something I was keen to see happen, and I understand we are on track for this, is that everybody in aged residential care, every resident who wants to be vaccinated, will have had at least their first dose by the end of June. Most will be fully vaccinated, which means that within 3 to 4 weeks after that, then the whole of aged residential care resident population will be vaccinated. So saying there is, of course, there are new residents coming in all the time, so it will never sort of be that 100%. My recollection is from Australia, they've got quite high coverage, it's about 84% of residents, and amongst those who aren't vaccinated, most of those are people who have been offered but for whatever reason have declined. Yes.
So when was that final date? Sorry, when is
So the intention is, and DHBs have concrete plans to ensure everyone in aged residential care, resident in aged residential care, has had at least their first vaccination before the end of this month, so before the end of June.
Do district health boards have waiting lists of sort of immunocompromised or sort of people who are at risk who they can call up on the ready of, we've got a vaccine ready and we can do you today?
Yeah, right from early on we asked them to have a sort of a list of subs to come off the bench, and so they have had that. Early on that was variable around the country, but we have asked of them more recently to make sure that the people on that list are people from the priority populations, either group 1, 2 or 3, so that it's not just or someone calls their mates up and, we've got random people coming in receiving the vaccine. We have, to the greatest extent possible, tried to maintain the sequencing as per the framework.
Because we've heard, from a parent who has an immunocompromised child and they can't even get on the waiting list, they have no idea if the health board even has their details, and then also we're hearing of, sort of people nominating their friends because they're a border worker to go get it. So how is that actually working, and have you sought assurances that district health boards do have that waiting list and they are actually using it?
Yeah, well, I know DHBs have had a waiting list, or they've been able to call people in to reduce wastage. That will be less of an issue from now because the vaccine can be kept for much longer periods. So less reliance on the waiting list, and the focus over this next 5 weeks is to make sure that the people who have got appointments are able to be vaccinated according to the appointment they've got. Perhaps a couple more questions?
Yeah, just some questions for a colleague on low flu numbers. Is that a positive outcome of our COVID response?
It is, absolutely. I've been watching this on a weekly basis, and it's the same. In fact, there was a story from Australia today, maybe yesterday, and there's one from ESR today, that we're just not finding flu in the country. And this reflects actually our managed isolation. So we're keeping flu out of the country. It's a very good thing. So saying, it's also good to have the backup, and we've got ongoing and increasing rates of flu vaccination. Yeah.
If that's the case, that there's so little of it in the country, what's the incentive for people to go out and get a flu jab? Should they still do it?
Yes, they should, and I'm certainly one of them, so I'll be doing that. I've got it booked, yes.
On other vaccines, actually, the original plan was kind of to have the measles immunisation campaign wrap up in October after kind of the COVID-19 vaccine campaign was dealt with. But are you still confident that you're going to be able to have the capacity to do that in October, given we'll still be in the, some of the teeth of troop 4 at that point? We actually took a conscious decision a few months ago just to sort of not pause, but to slow down the rollout of the MMR catch-up campaign. That's sort of 15 to 29-year-olds, and the reason for that was the need to prioritise childhood immunisation, flu vaccination, and of course COVID-19. There has been ongoing vaccination happening, I guess opportunistically, and we're seeing steady numbers come through. But part of the thinking here is also, as we move through the COVID-19 vaccination campaign, we want to leverage the infrastructure that's been put in place for that to then really push hard on getting the MMR vaccination out to that 15 to 29-year age group to do that big catch-up. And so the intention is to think about how we can use the booking system, the infrastructure and so on that's in place to do that. And you're still confident you can do that from October, because that was what the original plan.
Not by October this year, no. But from October. Look, we're thinking about it'll be from October, but it may well be into November, December. It's not going to be a 1 or 2 week effort. It'll be over a few months.
A question from a colleague too. Are you worried that fewer than half of those over 65 in South Auckland have been vaccinated, and are you doing anything about it?
Well, our overall vaccination proportions at the moment are about 6% fully vaccinated, 11%, that's across the whole population. Clearly South Auckland has been a focus, and the effort continues there, and I know that the DHB there and the providers continues to reach out into that, the wider South Auckland community, including the over 65. So I'm not sure exactly what the figure is, but it will be increasing all the time. It remains a focus.
You're comfortable with where it's at now?
Oh, well, I'll be more comfortable when it's even higher, but I think, very good progress, and it remains a focus, and we'll look to get it as high as possible over the coming weeks. In particular, as I said earlier on, everyone in Auckland over 65 is expected to be invited in the wider Auckland region within the next week or two. Unless there's one last question.
Take for your vaccine yet? The PM's getting hers on Friday. Have you got your?
Not yet, but I'll let you know, and I might extend a wider invitation if you want to join me, if you're in the same age group as me, of course that is.
Do you have the RNZ app on your phone, and will you uninstall it?
Yeah, misleading information. Yes, no comment. Okay, thanks very much. Appreciate you coming.